Good morning, everyone. Thank you for joining us for today's webinar, Social Security versus Medicare, Addressing Your Most Asked Questions, presented by Ray & Associates, a top 100 regional CPA and Senior Benefit Advantage. My name is Imani Fields, and I'll be walking you through a few housekeeping items for today's webinar. First, if you have any questions during today's presentation, you may enter them into the chat box on your screen. We will try to answer as many questions as we can at the conclusion of today's presentation. However, to be respectful of your time, we know that we will not be able to get to them all. Therefore, following today's webinar, we will review all questions and send out the answers via email as soon as we can. If you'd like a copy of today's slides, you will find that they're available in the handout section of the webinar dashboard on your computer screen. Today's webinar will be presented by Darlene Finzer, Rhonda Kraus, and Terry O'Shea. A principal and director of later life planning services at Ray & Associates, Darlene Finzer has more than 30 years of experience in the accounting industry. Darlene specializes in assisting organizations with legacy family planning, retirement readiness, financial fitness, and fiduciary responsibility. She has also been featured in several publications, including Benefits Pro and Thompson Newsletter. Terry O'Shea is a partner with Senior Benefit Advantage. He has a Bachelor's of Science in Mathematics and has had a 25-year career with a large primary metal company, alternating information between information technology and operational management. He was the manager of the International Data Center and responsible for the recommendation and acquisition of all computers for the company in Canada. He then moved to Cleveland, Ohio, where he was the director of information technology for a $2 billion sales manufacturing company. He was subsequently a vice president of information technology for Imperial Life Insurance of Toronto and Laurentian Life Insurance of Quebec City. He is an independent licensed insurance broker. Rhonda Kraus is an independent licensed insurance broker and owner of Senior Benefit Advantage, LLC. In addition to having 30 years experience as an insurance agent, she carries a master's in social work. While completing her MSW at the University of Akron, Rhonda completed internships at the Area Agency on Aging and Southwest Hospital with a focus on geriatrics. She also spent time as a certified application counselor in a federally qualified health center. And now I will pass it over to you, Darlene.
Thank you, Imani, and good morning, everyone. Thank you for joining us this morning for a discussion on Social Security and Medicare. We do have a lot of material to share with you today, even though it is not going to be all-encompassing. There's a lot of information that we could share in the future, but we're just going to scratch the surface today. As Imani mentioned, we are going to try to allow some time for questions at the end. So we're going to try and get through as much as we can to share information with you. So Abby, if we could go to the next slide, please. So Social Security and Medicare, these are topics that when you hear the mere mention of the words, it brings about confusing thoughts like this slide is representing, and what happens next is only natural. Yes, that's right, your eyes start to glaze over and your mind starts wandering, and you possibly are thinking, isn't there an easy way to understand this? While these programs are very complex, we hope that we are able to share some information with you during our time together today and to get you a little more comfortable with these programs. So I'll be starting the discussion this morning with the topic of Social Security. And almost every conversation relating to Social Security includes two main questions. Abby, if we could go to the next slide, please. So the first question is, will it be there for me when I am ready to start collecting benefits? Or if you are already receiving benefits, will it continue to last? As you can see on this slide, 6 out of 10 non-retirees believe that Social Security will not be able to pay them benefits when they are ready to collect. We could go to the next slide, please. And the second question is, assuming I will have benefits available when I'm ready to start collecting, is how do I maximize those benefits? So if you haven't thought about this question, or because you think, well, isn't my benefit already determined based on my work history and the amount that I've already paid into Social Security? The answer is sort of. And we'll go into more detail about this soon. But I thought it was important for everyone to know a little bit about the history of Social Security to understand why these two pressing questions, will it be there for me, and how do I maximize my benefits, are so prevalent in Social Security conversations today. Abby, if we could go to the next slide. So Social Security just celebrated its 85th birthday this past August. And just like us, when we turn 85, it probably needs a little attention and maybe a little bit of care. The major goal of the Social Security Act was to provide support and assistance to people who needed it most. That would have been the unemployed, retirees, and disadvantaged Americans. So the Social Security Act was enacted during the Great Depression. With high unemployment and less jobs available to be filled, part of the goal was to move older workers out of the workforce by providing them with a means to resources on which to live during retirement, in addition to whatever savings they had. I think that we can sympathize with the scene from the Great Depression, as we have seen a very similar scenario as we move through this world dealing with this pandemic. We have high unemployment, we have struggling or closed businesses. So kind of what they saw during the Great Depression. And here's your useless trivia for the day. I like history, I like facts like this, so I'm just sharing with you. But pictured here, the gentleman on the right is Ernest Ackerman, and he received the very first Social Security payment. So in 1937 through 1940, Social Security was actually paid out in lump sum payments. It wasn't monthly benefit payments. So Mr. Ackerman was the first one to receive the payment. He was in the program for 1 day. He paid in 5 cents, and he received 17 cents in payout. I think that was a pretty good investment for a 1-day investment, over 300% return. Also pictured here is Ida Mae Fuller, and she received the first monthly Social Security benefit check in January of 1940. And I'll share just a little bit more information about Ida Mae a little later on. So Abby, if we could go to the next slide, please. So this slide provides some notable historical moments in the life of the Social Security program. And as time has progressed, there have been some changes to the program, both in expansion of benefit recipients and increases based on the cost of living adjustment. Okay. There have been other measures taken to keep the program viable. And you'll see here in 1977, the payroll tax increased from 6.45% to 7.65%. So that's the percentage of Social Security and Medicare taxes that are withheld from individuals' paychecks that get remitted into the system. That happened in 1977. So you'll see that there hasn't been any change in that percentage in over 40 years. Abby, if we could go to the next slide, please. All right, so let's take a look at a comparison of life in 1935 as compared to today and see what changes have occurred that have people questioning the viability of the Social Security program. So in 1935, you'll see that the average life expectancy was under age 60, which meant that most people would not live to collect. If Social Security benefits could be collected full retirement age at age 65, if they didn't make it past age 60, they weren't going to collect. Ironically, Ida Mae Fuller, who received the first monthly Social Security benefit check, she won out on that. She actually lived to age 100, so she collected for many months under the Social Security program. So as you know today, average life expectancy is somewhere between 78 and 80 years old. And we know that people can outlive their retirement savings. Okay. I think it's also important to note on here a couple of other statistics. In 1935, the worker to retiree ratio was 160 to 1. So we had 160 workers who were contributing into the program for each retiree that was receiving benefits under the program. Today, that ratio is 2.8 workers to 1 retiree. Okay, so you can see that that statistic, that ratio is shrinking. It's almost a 1-to-1 ratio. The benefits that were paid out annually in 1935 was 1.7 million. The benefits today are over 980 billion, and that is billion with a B. Okay, so the question remains, will Social Security be there for me? And I would like to know from our group of attendees today whether or not you think Social Security will be available for you. So if we can launch the first poll question, please. Okay, so I want to know, do you think will Social Security be there for you? And we have the answers of yes or no. You can select that and enter, and we'll give you a few seconds here to answer that. Okay, so we have 73% that says yes and 27% that says no. So my thought on Social Security, will it be there? Yes, I do believe that it will be there, but I don't think it's going to look exactly the same as it does right now. So let's touch on that just a little bit. Abby, thank you. So I'm certain that you've heard that Social Security is running out of money. I thought it was important for everyone to know exactly what that means when you hear that message. So the Social Security funds are held in a trust, and you can liken that to a savings account. Okay, the contributions, which are the payroll taxes that are withheld from individuals' pay, are deposited into this trust fund, and distributions, which are the payments to the retirees, are made from this trust fund. So just like with a savings account, you can place money into the account, and when you need money, you take it out. But hopefully, you maintain a balance in that savings account. So if you remember back to our slide of the 1935 compared to today statistics, we had a worker to retiree ratio of 160 to 1 in 1935, and today it's 2.8 to 1. So while we still should have more contributions coming in than the distributions going out, you can tell that that ratio is slowly becoming almost equal. So with the trust fund, because the workers contributing and the retirees receiving a distribution are almost the same in terms of number of people. And remember, we have over 10,000 baby boomers turning 65 every day and moving closer to or into Social Security benefit status. Soon, this trust fund, or this reserve of assets, the savings account balance, if you will start needing to be used to pay for benefits that have already been promised. So what this chart shows, and this is in millions of dollars, it gives you a glimpse of the trend that is happening with this trust fund. And if you look at the net change column, you'll see that the net change is contributions less distributions, and you'll see that that amount is shrinking, which means that at some point the contributions coming in are going to be equal or less than the distributions going out. And when that happens, this asset reserve, what we have in our savings, we're going to have to start pulling that balance out to pay for those distributions. So when you hear about Social Security going broke, what that actually means is that this reserve of money is going to be depleted. Current statistics show that that is estimated to become depleted in the year 2035. The results from 2020 may actually tip us into the negative, which means that we might have more distributions going out than contributions coming in, which I'll touch in a minute. But what I want you to understand is that when you hear that Social Security is going broke, what that is really referring to is that this reserve of money is estimated to be depleted. So when that happens, just like with the savings account or a checking account, only the assets that exist can be used. So you can't take more money out of your savings account than what is actually in there. The bank won't allow you to do that. Same thing with Social Security. Social Security can't take out more than the money that is actually there. So that could lead to the potential for benefit cuts, which I'm sure that you've heard that also. But that is what is actually happening. It doesn't mean that there won't be any money at all. We just won't have a pool of money, a reserve built up to help pay for those distributions. So Abby, if we could go to the next slide, please. So what does 2020 results look like? Well, probably not good. The pandemic has had an impact to the Social Security program in two major ways. So the first is we've seen record high unemployment rates this year. If individuals are not working, then Social Security tax, which is withheld from paychecks, is obviously not being withheld. That means that there are less contributions being made into the program. So the second major factor affecting the Social Security program is a provision to help businesses that are maneuvering through this pandemic. It allows them to delay when they actually remit the taxes to the program. Okay, I haven't seen actual contribution figures yet for 2020, but I can only believe that the contributions will be down for 2020. Okay, Abby, if we could go to the next slide. So all is not doom and gloom. I know it sounds like it is, but there are potential fixes to the program that are and have been provided as potential fixes to the impending depletion of these trust fund reserves. So some of those discussed or offered as solutions are listed here. While all of these could be potential changes, I think some may make more sense and may be easier to implement than others. So I just wanted to touch briefly on this. The first one listed here is to move the full retirement age from age 67 to age 70. I think that that is possible. The fact that we are seeing longer lifespans, that we're seeing healthier adults at these ages. I mean, in 1935, people typically didn't make it past age 60. I think that we see active adults in this age range now. We've already seen the full retirement age move from 65 and it's progressing to age 67. So I think there's a potential that we could see that full retirement age move out. The other one is the second one that's listed. Currently, the first $137,700, and this is for 2020, that an individual makes is subject to Social Security tax. That number's inflated each year for the cost of living adjustment. But there has been discussion about making all earnings, so anything above that 137,000 would also be subject to Social Security tax. Obviously, we have politics that play into any potential changes, but from my perspective, I think those two make sense. I mean, the first one, we've already seen the age move from 65 to 67 with longevity increasing. I could see that being pushed even higher. Obviously, there's details to work out if that happens, but this gives you an idea of some of the potential changes that could happen. These are all to keep that reserve in that trust fund viable. Okay, so that would lead to not having reduced benefits, still allowing people to collect benefits that they were promised or that they're seeing that they should be receiving when they go to collect Social Security benefits. If you take anything away from this discussion, please know that Social Security is not going away, but it's highly likely that it is going to change from what we are seeing today. Okay, so now that you know that Social Security will be there for you, the next logical question is, how do I get the most that I can possibly get in benefits? And the answer is, Abby, if you can advance. Yep, that's right. It depends. And I know that's probably not the answer that you were looking for. But the short answer is you have to plan, you have to know your options, and you have to be informed. And I could ask, but I won't, how many of you know how much you will actually receive in Social Security benefits? It's estimated from polls that have been taken that 86% of pre-retirees don't know how much they'll actually receive. They just simply don't know. And how can you plan if you don't know what you'll be receiving? So Abby, if we could go to the next slide, please. So when to begin receiving Social Security benefits is based on your individual situation and various factors that are specific to you. Okay, at least 90% of recipients do not maximize the benefits that they can receive under Social Security. Why? Well, because they don't plan, they don't know their options, and they're not informed. When I mentioned at the onset of the discussion that this is a complex program, it really is. It isn't simply, well, today is the day that I'm eligible, today's the day that I'm retiring, therefore today is the day that I begin receiving benefits. There are literally hundreds of claiming strategies available based on the timing of when benefits begin. I like to use the analogy of taking vacation to that of claiming Social Security benefits. Could you just head out and go on vacation with no advanced planning? Well, the answer is yes, you could, but it might not be the best vacation because you've lacked the planning on it. The same holds true for claiming Social Security benefits or in planning for retirement, which is a whole other discussion. The decision of when to begin benefits is based on both subjective and objective information. Items such as expected lifespan, your health, family medical history, your ability to continue working, your personal finances, all of those play into the decision of when to begin claiming Social Security benefits. So let's say that your neighbor talked to you about Social Security and has you convinced that Social Security is going away, which we now know is not, and you want to get what's yours while you still can. So you start receiving benefits at age 62, which is the earliest you can begin receiving them. Your monthly benefit amount will receive a 25% haircut. So if you're supposed to receive $1,000 a month at full retirement age, your benefit if you start at age 62 would be $750 a month. And that reduction is permanent. There is no increase to the $1,000 when you reach full retirement age. You will notice on this slide the consideration of the cost of waiting, or the break-even point. So that's the point at which, regardless of when you begin receiving benefits, no claiming strategy is better than the other, because you would have amassed the same benefit at that particular point under whichever strategy you use. So in my example, it would mean that you would have to collect $750 per month for a longer period of time than you would need to collect $1,000 a month if you waited until full retirement age. So eventually, at some point in the future, the amount that you receive in total is going to be the same, but you need to look at when that actually happens and whether it makes logical sense based on your factors, your health, your ability to work, your family medical or longevity history. You need to consider what spousal benefits will be paid or received, what financial resources you have, all of those items. So walking through the options and running the numbers to determine what the various claiming strategies look like based on your specific situation is something that the RAY team can provide. And that leads us into our next poll question, if you would like to launch that. So the question is, do you think you need to have a claiming strategy analysis performed for you? We have 3 choices there. Okay, so we're split pretty evenly there as far as who thinks they should, that they don't, and ones that are not sure. So thank you for that. So I wanted to share some less known facts or possibly misconceptions that will help you in being more informed about Social Security. So the first is that you should wait for the Social Security Administration office to contact you regarding applying for benefits. No, this is actually something that you will need to do. While the Social Security Administration office will provide you with an estimated statement of your benefits upon request or beginning at age 60, they will not reach out to you about enrolling and beginning claiming benefits. You actually have to reach out to them. Abby, if you want to advance, please. Okay. The second misconception is that you can contact the Social Security Administration office to assist you with any questions you have or to discuss your situation to devise a claiming strategy. Well, it seems that that should be true. That is really not the case. The Social Security Administration representatives are available to process applications, provide reports. Essentially, they're performing actions that you request. Okay, they are not consultants, and they are actually not supposed to be giving any type of advice about Social Security. Next slide, please. So spousal benefits. This is an area that can become somewhat involved because there could be various factors relating to spousal or ex-spouse benefits. A spouse is entitled to benefits from their partner's work record. Okay, and if we could advance. And if you are divorced, you may be entitled, or your ex-spouse may be entitled to spousal benefits. So there are specific requirements, and we don't have the time to go into the details of that right now. But just know that there is a possibility for spousal benefits, even if you are no longer married to that individual. Spousal benefits is definitely one of the considerations that need to be included in determining when to apply for benefits. So if we could go to the next slide, please. Another statement is, once I start collecting Social Security benefits, I am not permitted to receive a paycheck. That is false. However, please note that if you start collecting Social Security benefits and you have not reached full retirement age, the amount of Social Security benefits you receive may be reduced. Okay. Also know that by working, whether you've reached full retirement age or not, it could cause your Social Security benefits to be taxed for income tax purposes. Next slide, please. So this statement, there aren't any do-overs permitted with claiming Social Security benefits. Generally, that is true. However, if you decide that starting benefits was not the right decision, for example, you started benefits, heard this presentation, had an analysis performed and determined you should have waited, you may have the ability to request a do-over. And obviously there are certain stipulations that apply. There's also the ability to take a hiatus from receiving benefits by voluntarily suspending benefits once you've started receiving, then resuming at a later date. And that option is only available after an individual reaches full retirement age. And the situation has to be right for you to take that option. Next slide, please. Okay, so this item, Social Security will contact me for information or regarding my benefits. I've added this to be certain individuals are alert to the fact that scams run rampant whenever it comes to Social Security. The Social Security Administration Office will not call you to verify personal information. They will not call you and require that you provide bank information to continue to receive benefits. Contact from the Social Security Administration will be made via mail letter unless you have requested them to call you. So, just be wary if you receive any type of communication from someone claiming to be the Social Security Administration. And the final item that I wanted to address is, if we could go to the next slide, the thought that Social Security and Medicare programs are one and the same. So that's completely false, although I understand why this might be misleading. If someone is receiving Social Security benefits when they turn age 65, they're automatically enrolled in Medicare. And it used to be that the full retirement age for Social Security was age 65. So many people retired at age 65, enrolled in Social Security, and consequently enrolled in Medicare, all at age 65. So now that full retirement age for individuals is progressing to age 67, age 65 is not as important as it once was from a retirement and Social Security perspective. However, that may be a different story for Medicare. So I'm now going to turn it over to Terry and Rhonda, and they're going to start their discussion on Medicare.
Yes, good morning, everybody, and thank you, Darlene, for the introduction. I can go to the slide. Okay. So, what is Medicare? Medicare is a federal insurance program administered by the Centers for Medicare and Medicaid, which is commonly known as CMS. It's a program that was introduced in the 60s by the Johnson administration as part of the Great Society Initiative. It was introduced in two halves, basically a Medicare half and a Medicaid half, which I think was probably a mistake in having the names so similar. Medicaid is for people of very low incomes, the poorest among us, whereas Medicare was the program for those retiring and providing health insurance for those over 65. It's often in the news, Medicare for all, but until you really need to find out what it is, it's a program that not many people get into. So typical questions as your retirement age is looming, well, how do I get it? Why would I get it? How much does it cost me? What does it cover? What doesn't it cover? When do I have to get it? Should I get it? All of these questions come up. So let's try and take a very high view of Medicare. Obviously, in the time that we have available this morning, we can't get into it, and there are many, as in Social Security, areas that could be refined and drilled down into. We'll just try and keep it at a very high level. So who is eligible for Medicare? Well, as Darlene said, 65 was the retirement age in Social Security. When Medicare was introduced, it was 65, and it still is 65. It has not moved with the Social Security full retirement age moving up. It is 65. So if you're over 65, you are eligible. If you're under 65, there are certain categories where you could be entitled to Medicare. If you've been on Social Security disability for 24 months cumulatively, then they will automatically put you on Medicare. Same thing applies with the railroad retirement disability. Also, if you have ALS or Lou Gehrig's disease or end-stage renal disease, you can go on to Medicare at any age. You also have to be a permanent resident of the United States and a legal citizen who has lived 5 consecutive years in the United States. Medicare is divided up into 4 main parts, and we see these letters being flashed around. Part A, B, C, and D. So what are these parts? Original Medicare, as it was introduced in the 60s, consisted of 2 parts, and it is still, those 2 parts are essentially the same as they were when it was introduced. Part A is hospital coverage. Part B is medical coverage. Since it was introduced, 2 other parts have been added. Part C, which is your Medicare Advantage part, and Part B, which is prescription drugs. Prescription drugs were introduced in about 2005, 2006. Medicare Advantage was introduced with a different name in the 90s. It kind of failed. It was reintroduced in the early 2000s and is now obviously a highly successful program. So let's concentrate on original Medicare first of all. Part A, hospital insurance. So what does it do? When you go into a hospital, it covers you. You go out of hospital, go into skilled nursing care, it covers you. It covers hospice care and some home care. But it doesn't cover everything. In 2020, if you go into a hospital for an incident, whether you go in 1 day or up to 60 days, there is a $1,408 deductible that you would pay. If you go into hospital and come out and then go back in a few days later for the same incident, then that is considered the same benefit period. But once you come out and stay out, If you go back in 2 months later, for example, the whole cycle starts again. So you can have multiple benefit periods within a year, and each time you would have to pay the deductible of $1,408. If you are in the hospital for more than 60 days, then there is a $352 copay for days between 61 and 90. If you are still in the hospital after that, you have 60 lifetime days. In other words, you get 60 days. When you've used them up, they're gone forever. And it's $704 copay for each of those lifetime days. And if you are still in hospital after that, you pay all costs. Part B, for original Medicare, are doctors. So it covers doctor's services, any outpatient medical surgical procedures you might get, clinical lab tests, durable medical equipment, and preventive services. And how much does it pay of that? Well, it pays 80% of the Medicare negotiated rate for covered services. So you pay 20% of that rate. Go into skilled nursing, the individual pays 0 for days 1 through 20. And then in 2020, it's $176 a day for days 21 to 100. That is going to $184 per day in 2021. And then over 100 days, you would be paying all costs. Original Medicare does not cover prescription drugs. It doesn't cover the deductibles or co-insurance that you might be eligible for. It does not cover dental. It doesn't cover routine eye exams. It doesn't cover foot and hearing care. It is just really basic medical. And what does it cost an individual? Well, original Medicare, if you have 40 quarters in Social Security payments, then Part A is free. If you don't have 40 quarters, you can get Part A, but you would have to pay for it, and it depends how many quarters you have, how much you would have to pay. Part B has a sliding scale of payment. The Part B cost, basic cost in 2020 is $144.60 a month. Added to that is what is known as IRMA, or the income-related Medicare adjustment amount. And this is based on your income from 2 years before. So in 2020, they're looking at what you reported in 2018, and if it was $87,000 or less as an individual, or $174,000 if you filed jointly, then you are paying $144.60 a month. And then it ramps up between $87,000 and $109,000 as an individual, $202.40, and so on, according to that chart. And if you reported more than $500,000 of income, you would be paying $491.60 a month. This might be a good time for the first poll question.
And as we're moving to that first poll question, I just want to add in here, Terry, for our clients' benefit, any tax clients, individual tax clients, know that we are looking at this IRMA surcharge for our clients to ensure that we can try to minimize that for you as much as possible. So I can give you an example. We had a client just this past tax season that by doing the analysis for them, we saved them $5,000 in Medicare premiums because we're doing that analysis.
Good. So Not sure. Well, no, they don't. So I guess 46% of you were right on that. Thank you. No, Medicare is individual, and unlike Social Security, which has many ramifications in terms of the family, spouses, dependents, disabled children, looking after people, Medicare is strictly one person. Okay, when can I sign up for Medicare? Most people join in what is called the initial enrollment period, or IEP, which is a 7-month period, which begins 3 months before your 65th birthday. It includes the birthday month and the 3 months after that. If you sign up for Medicare in the 3 months before your birthday month, coverage will start on the first day of the birthday month. It's quite important to know that, because if you don't enroll during that period, the start of your benefits is staggered by CMS. So if you sign up in the month that you turn 65, your benefits would start 1 month after you signed up. If it was in the month after you turned 65, it would start 2 months after you sign up. Now, note that that is after you sign up, not after your birthday month. So if you signed up in month 7 of this initial enrollment period, then you wouldn't begin your benefits until 3 months after that. Now, it's quite important to get the timing right, because if you mess up, you don't sign up during that initial enrollment period, then you can sign up during what is called the general enrollment period, which is January the 1st through March 31st of every year. If you do that, benefits start on July the 1st. So if you signed up on January the 1st, you would still only get your benefits starting, or Medicare starting, on July the 1st. And you also have to be wary, because we'll get into this later, that there is a penalty associated with not signing up when you could sign up. There is also, which is quite important to a lot of people, those people that are continuing working beyond 65, or they are covered through their spouse's group health plan, or they have retirement health plan through their own work. The question comes up very frequently: will I be penalized if I work until I am, say, 68 and then retire? And the answer to that is no. You have a special election period as long as you have had creditable health coverage. When you retire, again, in our example, say you retire at 68, there is an 8-month-long special election period which begins the day you lose health coverage, the day you lose your position or retire. So you have 8 months to apply for Medicare. But you have to be careful with that. If you're taking COBRA, COBRA is not considered to be creditable insurance, and so it's still the 8-month period, even though COBRA could be longer. And if you have decided that a Medicare Advantage plan is what you are going to get, the special election period for an Advantage plan is only 2 months. So you should apply in the first 2 months after the retirement. Okay, do I need to apply for Medicare? Well, if you've decided to take Social Security before you turn 65 and you're receiving Social Security, then Social Security will automatically enter you into Medicare, and you'll be signed up for Parts A and B. And then if you decide you don't need Part B at that point in time because you have otherwise health coverage, you can drop it. But if you're not receiving Social Security, you have to apply for it. And that is through the Social Security office. And these days it is either telephone call, they'll probably set up a telephonic appointment with you from Social Security, or you can use their website and do it that way. So that was the original Medicare, and now we're going to start covering the add-ons, things you can do in addition to having original Medicare. The first one we're going to talk about is what is called a Medicare supplement or a Medigap. Because when Medicare was introduced, individuals are paying 20% of the Medicare negotiated rate. There is no limit to how much that 20% is. There is no cap, no upper limit. And so insurance companies were quick to step in and say, we're going to sell insurance to cover that 20%. And so this has been around for quite a few years. And the idea of Medigap was it covered that gap in Medicare. It is only medical insurance. It does not cover prescription drugs, for example. Now, the gap is covered wholly or partially depending on the kind of Medicare supplement plan that you have. These are standardized by CMS, and there's a little alphabet soup, plans A through N, and any plan F, any plan G, any plan N is the same as anybody else's plan F or G or N. Open enrollment for a Medicare supplement plan is when if you apply at 65 for Medicare and you get your Medicare card, you have an open enrollment period where no matter what your pre-existing conditions, no matter what your comorbidities, you can get a Medicare supplement plan. If you decide subsequently after that open enrollment period is over that you're going to get a Medicare supplement plan, you may require, or the companies that you're looking at may require medical underwriting, which could be difficult to get. One of the disadvantages of Medicare supplements is that it might be quite a reasonable premium when you first get it, but the premium is often attained age related, which means as you age, it will go up. It is also experience related in many cases. So if the plan that you're in is having a bad year in that particular state or region, then you could get a second increase in the year. To have a Medicare supplement, you have to have Medicare Parts A and B to get it, which means that you do have to pay that Medicare Part B premium. Now, Part D of Medicare, as I said, was introduced early 2000s. It covers prescription drugs, and it is usually going with original Medicare and a Medigap plan. You can have just original Medicare and a prescription drug plan. You can have original Medicare, a Medicare supplement, and a prescription drug plan. You can have like all three of those. It can also be embedded in a Medicare Advantage plan. What does it cost? Well, you pay a plan premium. You choose the particular plan that you want, and the choice of that plan would depend on what's available in your particular area, what the cost of the plan is, but particularly what the plan's formulary is and what prescriptions you are taking. And there's a government website and other websites that we use when we are talking with individuals to take a look at the prescriptions and come up with what is the better plan or the most appropriate prescription drug plan for that combination of prescriptions that you are taking. So there's a planned premium, but then also there is the same IRMA adjustment to it, the same income categories going from an additional $1,220 a month if you're over 87,000 but under 109, up to an additional $76.40 a month if you're over $500,000. There are late enrollment penalties, so beware when you're getting Medicare. If you do not get Medicare Part B when you could have it, unless you qualify for a special enrollment period, such as we discussed earlier, like retiring and you have creditable group health care, your monthly premium will go up 10% for every 12-month period you could have had it, but didn't have it. Also, there is a penalty on the prescription drug side, on Part D. So I think this happens more frequently where somebody who gets on Medicare at 65 and says, I am taking no prescriptions, I don't need a prescription drug plan. And then 10 years down the road, the doctor says, well, I hope you got a good prescription drug plan because I've just put you on something that costs $500 a month. And you sign up for a drug plan and then you discover that you have a penalty. And that penalty is the CMS has what they call their national based premium. They've calculated that an average prescription drug plan in the United States costs $32.74 a month. So they take 1% of that times the number of months that you did not have creditable drug coverage. So in our case of somebody who's had Medicare for 10 years, it would be 120% of that premium, $32.70, is added on to your prescription drug cost, and both the Part premium and the Part D, the Part B penalty and D penalty are permanent. You will pay that for the rest of your life. I'm going to go into Medicare Advantage, but this might be a good time for the second poll question. So when I go into Medicare, what does my younger spouse do for health insurance? That's a huge block of not sure, 45%.
Wow.
Okay, excellent. As I said, Medicare Advantage is a very popular and increasingly popular way to get Medicare. There's now approximately 30 to 33% of the people on Medicare are through Medicare Advantage plans, and you cannot escape the commercials for them. Anytime you turn on the television during this annual enrollment period, you have Joe Namath or somebody exhorting you to check it out. So Medicare Advantage is Medicare administered through private health insurance companies. It was set up in the early 2000s. What happens with Medicare Advantage is that you sign up for a plan with a major carrier or whoever, one of the big insurance companies, and Medicare pays a monthly fee to the carrier for taking care of all of the administration of that individual. So Medicare does the administration for original Medicare, but if you join a Medicare Advantage plan, it's passed over to the company that has your plan. So it combines Medicare Part A and Part B, original Medicare. Sometimes, and that is in the neighborhood of 90% of the time, it also includes Part D, or prescription drugs, and you must have Parts A and B of Medicare to be able to get one. So you're paying that Medicare Part B premium. The Medicare Advantage plan must cover everything that's included in original Medicare as a starting point, but then they often include all of the things that they are advertising on television. Some dental benefits, transportation benefits to and from your medical appointment, vision, hearing, meals when you get out of hospital, acupuncture, over-the-counter catalogs and allowances, personal emergency systems, and so on. It's selection is quite vast, and these are all of the things that they push on television, the free stuff that Joe Namath talks about. So what should I do? Well, it is a very individual thing. It depends on your circumstances, your income, your particular likes, dislikes, the state of your health, whether you're very healthy or not. So you could just take original Medicare. Advantage of that is that you can go practically anywhere. You can see any facility that takes Medicare, and while there are some private paid doctors and facilities in the United States, the vast majority do take Medicare. And you only pay the 20%. They pay 80%, and it is the Medicare approved rate that you pay. However, there is no upper limit to it. You have some major occurrence, heart, cancer, you have to pay. You can add the Medicare supplement, which is a very popular thing to do. So it's very convenient. You pay one monthly premium, and most bills are taken care of. So there was a Plan F, or still is a Plan F, which covered absolutely everything. For anybody becoming eligible for Medicare after the 1st of January 2020, that plan is no longer available. It's a Plan G, which pays everything that the Plan F paid except for the Medicare deductible, which in 2020 is $198. Or you can have other plans where you pay copays to the doctor with varying premiums. So the only difference between going with one carrier or another is the cost and their viability. You can add a standalone prescription plan, and premiums increase every year at this advantage. You can choose a Medicare Advantage plan, which you pay your Medicare Part B premium, but you can have a very low premium, $0, for example, in addition to your Medicare Part B, or a minimal premium like $19, $15, $21 a month. And then for that premium, you can get the drug plan. It's embedded in it. Quite often the plans they take care of the Medicare medical deductible and some or all of the prescription deductible. And you pay as you use it. There are copays and coinsurance. So healthy people, relatively healthy people, this might be a good fit. There's also in these plans, you could consider it to be like catastrophic coverage for Medicare, because they all have a maximum out-of-pocket for the individual, which varies between, say, $3,000 and $7,000, depending on the plan that you choose. These plans come in different network strategies. There's HMOs, the health management organizations, the PPOs, preferred provider organizations, and there are some other minor ones, variations. Now, HMOs today are really not what they used to be in the 90s with extremely limited networks. If you choose a major carrier, their networks are vast, but you do have to make sure that as an HMO only pays for those providers in network, that the people you want to use, your doctor, your facilities that you want to use, are in a particular network. The preferred provider organization has a network where you pay less if you employ the network, but will pay some part of an out-of-network provider. So these are your options. What you choose is entirely, an individual decision. I realize it's very fast. It's an overview, and we didn't get into any of the details which we could do. So who are we? We are Medicare specialists, Senior Benefit Advantage. We are located in Akron, and we have an office in Coshocton. And our goal is we strive to improve the health care for all Medicare beneficiaries, one client at a time. That concludes the formal presentation. We have questions.
Awesome. Thank you so much, Terry. And we had a lot of great information today, and we have a lot of great questions. So we're a little bit over, but to respect everybody's time, we will be sure to reach out to you guys directly with the answers to these questions. Of course, if you have anything else that you would like to ask, you can always reach out to Ray and Associates or Senior Benefit Advantage directly. If you sign off today and realize that you have additional questions, you're always welcome to reach out to any of the presenters. And thank you again, and we hope you have a great day.